Hey guys, Jake with Premier Health Chiropractic again. Just wanted to give you a little bit more in-depth view of the SRT program and each step of that process, okay? So the very first thing that we're going to have you do when you come in and you start SRT is work on loosening up some of the tension and the musculature in our neck, okay? Now, throughout our day, just with kind of how we move through life right now, a lot of texting, a lot of sitting on a computer, typing on a computer, even sometimes the way we just drive and we sit throughout the day, it's really going to contribute to a lot of that forward head posture, which is a lot of tension and tightness and some of that musculature in the front of the neck here, okay? Now, what we're trying to do is loosen some of that up through 6 different stretches so that when we move you into the second stage here, which is repetitive cervical traction, you're going to be able to allow a little bit more blood flow and nutrient flow into the discs of the spine. This is also going to aid in your ability to move a little bit more fluidly when you get adjusted right afterwards. So I'm going to walk you through each step of that. The last thing here you see next to me is a vibrational plate, okay? So what this is designed to do is we're going to have you perform all these 6 stretches on your neck on the vibration plate. The reason being is it's going to really help increase some of that blood flow and some of that nutrient flow as we get it up to some of the higher levels. It by no means is absolutely necessary. It does just aid in moving things around a little bit better. If you can't handle that due to vertigo or you get lightheaded or dizzy at all, it's totally fine. You can do these stretches without it. But as you may have seen in the other video, what we're going to do is gently just pull our ear down to our shoulder like this so that we can stretch out some of the trap and a little bit of the scalenes on the side of the neck here, okay? Now we're typically going to hold this for about 30 seconds and we'll follow that immediately by the opposite side. Okay, so gently just pulling ear to the shoulder. Second stretch we're going to have you do is we're going to tuck the chin, look over to one side, so I'm looking to my right, I'm looking over my hip at my right foot, right hand on the back of the head, and I'm just going to gently pull forward so that we loosen up a little bit more into the lower trap now, some of the neck extensors, and even like the levator scapula here. Once again, we'll follow that by the opposite side as well, okay? And the third and final one, we're going to look off to the side. So if I'm looking to the right, use my left hand on the forehead. I'm going to gently pull up and back, so we're going to stretch on the upper outside of the neck to really help stretch out some of the neck extensors here. Okay, and once again, we'll follow that by the 6th one on the opposite side. So holding each of those for anywhere from 30 to 40 seconds at a time is the very first stage that we're going to walk you through. Now, this is going to really help with just overall tension and pain that you may get in your neck due to whatever the cause may be, but it's also going to help position you a little bit better and allow you to move a little bit more fluidly, like I said, as we move into the traction unit next and when you see your doctor for your adjustment. Thanks.